Hey, what's up, everyone? It is John. I am a dental assistant. I've been one for 30 years. So, today our video is going to be on radiation education, specifically dental x rays in the practice. So, whether you are a dental professional or whether you are a patient, of course, we always hear it from the staff side of, I don't want x rays. I'm afraid, I'm going to glow in the dark, right? These are some things we hear. So we're going to break down a little bit the education of what that radiation is, and of course, why do we take these dental X-rays? You hear patients say, "Well, I had X-rays taken 2, 3 years ago," or "You took X-rays last time." So we're going to explain the difference in the X-rays and why it's so important to stay on top of those. So first thing we're going to talk about is a dental X-ray. So whenever you go to a dental office and they want to take X-rays, typically as a new patient, they want to take X-rays to, your first time coming in. They want to see what's going on. They want to establish you as a patient, see what you have had done, and see what you need to have done. So there's a variety of different X-rays that they can take with you coming in as a new patient. So a couple of those options might be a Panorex. So the Panorex is an X-ray, goes all the way around the head, and it's going to show some important features, some structures of anatomy. But the thing about the Panorex is it is a 2D image of a 3D object, the 3D object obviously being us. So also when it goes around your head, it can lead some distortion. So you might see some overlap in the teeth. So it's great because it does show the teeth, it shows some diseases, abnormalities, and of course, it shows us those impacted teeth, those wisdom teeth. It shows the TMJ, sinuses, etc. It's great for those things. But when it comes to diagnosing, it's not as accurate because of that overlap and that 2D, 3D that I was telling you about. Now, full mouth series of x-rays. So the full mouth series of x-rays, this is typically 14 to 18 periapicals and bite wings taken together. These are great because it's capturing single shots and it's capturing the apex of the tooth. We're seeing the complete teeth on these. So these are great for diagnosing. They're more accurate than a Panorex. Then we have our bite wing x-rays. These are the most common. No matter what you say, hey, I'm going to take an x-ray. Oh, you mean those wing things, those wing x-rays? Yes, the bite wing x-rays. Bite wing x-rays are some of the most commonly taken x-rays because whenever they're taken at the first visit or whether you're coming in for 6 month and 1 year checkups, the bite wing x-rays are great because they typically are two or four total x-rays on the side of your mouth. And what we're looking for when we take these x-rays is we're trying to see interproximally, so in between the teeth, it's going to show us if you have any cavities there or even starting. So this is why we constantly preach flossing and taking care of your teeth. So when we're taking these x-rays, we're essentially trying to get it parallel and we're trying to get it so that we can see in between the teeth. We don't want any overlap with these as well because that can prevent some of our diagnosing. So, and then of course, back to the periapicals where we can see the complete apex, the complete tooth. When we take those single x-rays, that's what we're looking for. Now, whether you're a patient or a dental professional, it's always good to understand and educate as to radiation wise. Everybody's afraid of it. Uh, you know, I don't want to glow in the dark, going back to that, right? So we have our periapical. A periapical is zero point 0.2 microsieverts of radiation. Now you'll hear a lot of people say, well, you get more standing out in the sun or on your cell phone. This is where you want to know the radiation level, and also it's good to keep some kind of chart up in your practice, especially where you're taking x-rays. So what's one of the most common things we hear that it's equivalent to? Well, how about a banana? So zero point 0.2, banana is actually 0.1 of radiation. So a lot of our food actually does contain radiation. So the banana is typically one of the easiest ones to identify. I myself, I eat a banana every day. The potassium's great. I'm a runner. So it's great for your legs. So that's typically my go-to is the banana. Of course, there's other things you want to know as well. A flight from the East Coast to the West Coast. These are things that you can help relate to your patient and explain the importance of dental x-rays. Now, full mouth series of x-rays, 3.9 microsieverts, so just under 4. So, this is where you want to be able to equate that to, living in a brick building, or whether it is that flight, like I mentioned, certain foods, total radiation that humans receive over the course of a year, etc. So I hope this helps today as far as explaining x-rays. And moving forward, like I said, whether you're a patient or you're a dental professional, keep in mind the state laws have even changed with lead aprons. So some patients don't have to wear lead aprons, some operators don't have to wear lead aprons. Please defer. That is state dependent, so defer to your dental state board for that. And don't just go by, I did a video a little bit ago about radiation. Don't just go by, hey, we live in a day and age where radiation is minimal. That's not the case. 13% of practices are still using traditional film. And on top of that, there's a lot of practices still using wall units. So that radiation is more out of the wall unit than a handheld unit. So, you as a patient, you want to educate yourself as far as what the practice is using. And then also dental staff members, educate your patients and let them know what you're using and, the equivalent of radiation that they're receiving. So I hope this helps for today. One thing I want to rewind on is bite wing x-rays. That is also office dependent on their patient. So some offices are taking bite wing x-rays every 6 months, a year. Some of them, they're going out as far as 2 years. That obviously depends on your patient and Carrie's history. So once again, hope this video helps. Please feel free to drop a comment below. I'm always interested in finding more information to add to. And, certainly if you have a topic you'd like to discuss or go over, feel free to contact us at cornerstonedainstructors@gmail.com. And of course, you can find us on all the social media platforms, YouTube, TikTok, Instagram, Facebook, and of course, look at the Dental Assistant Nerds podcast.